All right, Dr. Jenkins, I see we've got 5 o'clock. I think we have a quorum.
I believe we do, Dr. Ray.
So unless anyone objects, why don't we go ahead and get started? Thanks everybody for being here this evening. It's our February Board of Health meeting. I hope everyone had a fantastic holiday season. I don't know if you're like me, but it felt like January was forever, and now we're halfway through February. So hope everyone's having a great 2026 so far. So we'll go ahead and get started. Everyone received the agenda, but I do want to pause before we get started and welcome Dr. Rhodes, the newest member to our Board of Health as our optometrist. So Dr. Rhodes, welcome and thank you for joining us.
Thank you. I'm so happy to be a part.
Fantastic. And I did want to also thank several board members who were reappointed recently since our last meeting, Mr. Gregorio, Dr. McDougall, Dr. Orto, and Dr. Miller, all agreed to stay on for additional terms. So thank you all very much again for your service. All right, so first line item on the agenda is approval of the current agenda or any adjustments. Does anyone have any adjustments that they want to make to the agenda? All right, hearing none, we'll proceed without adjustments. The next item of business, review of minutes from prior meetings. Donna did send out meeting minutes from October and November. Hope everyone had a chance to review those. Does anyone have any adjustments that they want to make to the minutes? If not, I'll accept a motion to accept the minutes in the record as they are.
I move to accept the minutes.
All right, we have a motion, a second.
Second.
All right, fantastic. I think we're ready for a vote.
Thank you, Dr. Ray. I'll be doing my best Donna Murphy impression this evening. One question before I call the roll to accept those minutes. Do we need to do a roll call to bring the meeting to order?
Are we good?
We're good. Okay. So I'll do the roll call to accept the minutes. Dr. Ray?
Yes.
Dr. Jackson?
Yes.
Mr. Brown?
Yes.
Mr. Gregorio?
Yes.
Dr. McDougall? Dr. Miller? Dr. Orto?
Yes.
Dr. Rhodes?
Yes.
Dr. Silverman?
Yes.
Commissioner Valentine? And Dr. Verbies?
Yes.
And Dr. Miller is a yes.
Thank you.
All right, fantastic. Thank you all very much. Liz or Dr. Jenkins, do we have any public comments this evening?
Not that I know of, Chairman Ray.
All right, fantastic. Thank you. All right, so moving right along, we do have a number of reports and presentations this evening. So the first one is our FY 25-26 Q2 fiscal overview. And Ms. Gwendon, I believe, is here to present that. So I will turn it over to you.
Good evening, everybody. Happy to be with you all again. I'm going to share my screen, start my presentation. And if someone could give me a thumbs up that you can see everything and hear everything, awesome. Thank you, Dr. Ray. All right, thank you all for the opportunity again to share about our fiscal news for Q2 of fiscal year 25-26. I always tell you where we start the year, and this year that was at $28,410,835. We have moved $186,703 into the budget this year via amendments and rollovers. And I was just reflecting on how small of a number this is this year. If you've been with us for a couple of years, you're used to this number being really large. A lot of that due to COVID funding coming in, that over these last couple of years, we're starting to see that dwindle. So I was kind of like, wow, this is such a minimal change to our budget, leaving us currently at $28,597,538 to date as our current budget. Our expense budget is just over a smidge over $40 million, and that does exclude county benefits. This is a 1.14% increase to where we started the year, which again is a smaller percent increase than we're used to seeing. We have spent $17,613,075, or 44% of our general fund expense budget as of Q2. Contract spending has caught up at this point, which was a significant change from last quarter when a lot of our contracts hadn't gone through yet. Our personnel costs, including salary, FICA, and retirement, total $11,889,611 in Q2. Contract spending in Q2 is also, of course, one of our higher items, $4,391,157. Some specific items from Q2 that I wanted to share were that we purchased $6,350 of opioid supplies, including fentanyl test strips, bandages, and antibiotic ointment. We bought $4,571 in COVID vaccines and $3,508 worth of yard signs. The yard signs were a population health division project that was done in partnership with Durham Public Schools and our DINE program. And those yard signs advertised DPS's Universal Free Meals program. We printed them in English and in Spanish, and they were distributed all over the county. The department has brought in $3,456,533 in revenue as of Q2, making up 30% of the revenue budget. This is lower than I would like to see, but that is largely due to the delay in receiving our quarterly Medicaid directed payments. We've only received one quarter of that this year, but actually today we received notice of the second quarter. So the state was a little bit behind on that, and they told us about the delay, and we received it today. So that will show up in our Q3 payments. But that's why this is a little bit low. That'll be posted soon, and we should see this number rebound. This slide also illustrates that Medicaid lag, as we hardly ever see Medicaid dollars coming in under our grant revenue, although those two tend to be pretty close. But grant revenue totals $1,715,508, and Medicaid is at $1,456,530. As usual, those two revenue sources are making up the 92% of our overall revenue, which is right in line with what is typical. And we have also brought in $284,606 in service fees so far this year. Last but not least, I always like to tell you a little bit about our opioid settlement fund projects. Those remain the same as in previous quarters. Our community linkages to care, our harm reduction, and the administration of the county's opioid activities all fall within public health. At the end of Q2, we've spent 41% of our budgeted expenses. Contracts have caught up here as well, and that's why you see this big jump from last quarter when our spending was only 13% for opioid funding. So just want to end with some words of gratitude for you all about your attention to the fiscal matters of our agency, and I'm happy to take any questions, Chair Ray, that anybody may have at this time.
Gwyneth, thank you very much for that presentation. I really appreciate it. Do we have any questions about the presentation? All right, hearing none. Thank you very much. Appreciate the update.
Absolutely. Thank you.
You're welcome. All right, next on the agenda, we have Ms. Scott here to talk to us about adult daycare services for seniors.
Hello, good afternoon. I'm going to readjust my screen so I can look at you all. And I'm going to share my screen. Is anyone or everyone able to see my screen?
Not yet.
Okay. I may need to call for some assistance here. Okay, my apologies. I need to consult my IT person.
Okay. No problem.
Assistance is on the way.
Here. Thank you. Representing? Yes.
All right, there we go. We can see it, but you're still muted.
How about now? My apologies.
Yes,
Wonderful.
looks and sounds great.
Wonderful, thank you. My name is Cheryl Scott. I work here in medical services. I'm one of the program managers, and I'm going to share a brief presentation on Durham County Aging and Adult Services. I'm going to focus on adult daycare and adult day health. Okay, these services generally refer to programs and resources. They're designed to support older adults and individuals with disabilities. The adult daycare and health programs provide support for individuals in their home. They help them manage their resources, case management, nutrition services. Most popular or well-known is the Meals on Wheels. They help coordinate that, and transportation services as well. I want to briefly discuss the purpose and target population, core services, activities, staff and licensing, eligibility for these programs, as well as some funding. The purpose for presentation. Just give me a second. Start from the beginning. My apologies. I'm having some more technical difficulties here. Where's the PowerPoint? Here is the PowerPoint. Is this a over? Yes. Okay, you clicked it on. Yeah. Where is it? I don't see it. Okay, so you want to go to slideshow. Go to slideshow. And then from beginning. From current slide? The current slide. Current slide. Yeah. There you go. Okay. Thank you. The challenges of technology. I'm behind. My apologies. Okay. The purpose of these programs is to help these individuals to maintain as much independence as possible, because as individuals age, as I know anyway, it's not as easy to do things, to climb around, run or walk as it was even 10, 15 years ago. So as we age, it's to help us in these sites help to maintain as much independence as the individual is capable of, to help them maintain their potential. They're also very helpful in helping avoid being institutionalized in long-term care or assisted living. because a lot of people want to stay home. They just need that extra support and encouragement to do that. This also improves the health and mental and physical well-being of individuals. And it certainly helps caregivers reduce their stress, because a lot of caregivers, this is brand new. Many people have not been trained to take care of personal needs. It comes upon them. They don't know where to turn. These homes help provide those resources to give the caregivers support as well. It helps them reduce their stress and provides them some help and support as well. It also, these homes also provide community support. Now, for the adult daycare and adult day health, both homes, they're a little bit different. The adult daycare and the adult day health programs are both community-based. They provide group care for older adults, and they provide this social, emotional, and physical support, because it helps people to maintain their independence. As I say, if someone is using a walker, if they're capable of using a walker, they're encouraged to do that with support and encouragement. And it's great to see someone's big, beautiful smile come on their face when they say, oh, I can do this, I can do this. That's a feeling like no other, just to watch that. For adult day health is something extra. They have a little extra that addresses the physical aspects of some of these individuals. They have nursing oversight, and this nursing oversight is comprised of CNAs, LPNs, and RNs. There's medical monitoring beyond the standard care. So the adult day health programs, there are 2 in Durham County, and public health has a strong relationship with those, because DSS manages the adult day care programs. They do the monitoring, they do the inspections, they do all of that. Durham County Public Health is responsible for monitoring the adult day health programs, and there are 2 in Durham County. I'm the adult day health specialist for those 2 homes, so I'm responsible for monitoring those, and I'll talk a little bit about that more in a little bit. So there's medical monitoring beyond the standard daycare. These aging and adult services are very important to, like I said before, connecting to resources, which include nutrition services, personal care, and in-home support. Some of these programs, some of these individuals are eligible for in-home aid services. So if they happen to have something that's in their income or a barrier to them accessing these services, they're connected to in-home aid services, which is also a DSS program. So they have a very good connection with the community programs and Durham County Department of Social Services as well. They also have a social or health focus. The adult daycare definitely have a social focus. The adult day health homes have both. Like I said before, it's caregiver support, and they do offer adult protective services if needed. And these homes are also responsible for reporting that if they have any concerns, or if anyone comes in and they have concerns, they do report those to adult protective services here in Durham County. Like I said before, it promotes independence. It really improves someone's quality of life. Because sometimes individuals, they may live with a parent, an adult child who has to work. And a lot of times they may be at home, with few visitors to come, check, and a television set. So this provides them a whole community of people. If they aren't able to speak well, or if they have speech therapy, this is a place where you're likely to see someone with your same level of ability, I want to say, and that's a connection for them. It's always good to see that someone is close to how you are. That gives you a connection that you don't see every day when you're home by yourself, or if you're looking at television. So this helps improve the quality of life. You get to speak with other people. If you can't speak well, you're there and you're able to smile, you're able to laugh. You have people to come check on you. You have people that assist you in eating. And if they see that you're able to do a little bit more, they encourage that. They're not forced to do it, but if they see some potential, what I've witnessed anyway, if they see potential in these individuals, they try to grow that potential in these 2 adult day health homes, because I go there once every quarter. So that's great to see too, that staff are really invested in making sure these individuals get the best that they can get from their programs. There's education and training, not only for the staff, which is their education and training is ongoing, but they have it available for caregivers as well. And there's that emotional support that the caregivers and the participants really do appreciate and need. When selecting the program, it's always good to look at what the medical needs are first, because going to an adult day care program is not going to be able to address those medical needs. So that's the difference. One of the main differences between selecting adult day care and adult day health. Fortunately, the 2 adult day health programs in Durham County, they're combined with adult day care programs. So the adult day health individuals get to merge and communicate and socialize with all the participants in the community. You want to check for staff licensing and qualifications. The adult day health homes definitely are required to have a nurse on staff. If an LPN is on staff as the healthcare specialist, that's fine, but an RN must be the supervising nurse for that individual. And they also have certified nursing assistants too. So that's good. And you also want to review the cost and coverage. Medicaid is a big payer for these individuals, as is Medicare. I'm going to spend my last few minutes just focusing on the 2 adult day health homes that are in Durham County. I'll start off with the home on the right, the Durham Center for Senior Life. It's a couple of blocks from here up on Rigsby. It offers a nice, safe environment for older adults and those with disabilities. And these individuals, of course, are unable to live independently. They offer a peace of mind to the caregivers. They can be assured that they're being cared for, by trained staff. They also have scholarships that are available to families if eligible. And their accommodations include professional caregivers. They have activities, classes, they have games. They assist with personal care and mobility, medical supervision and monitoring. They have a hair salon and barbershop. They have a theater that individuals can look at movies on. They have a nice gated outdoor garden. It's secured, so no one can walk in and out. And when they're out there, someone is, of course, is always with them. And they have spaces for relaxation as well. They have a beautiful activity room where individuals can sit. They could sit in a circle, and you can fit a wheelchair in there, a chair. Everybody sits together. And when they have activities, the recreational staff will usually sit in the middle, and or if they have more than one person, someone will sit with the participants and someone will be in the middle, and they'll play the guitar, they sing, they dance. It's really great to see. Eligibility for the Durham Center for Senior Life. They must be a Durham County resident. The caregiver and the care recipient must live in Durham County. The recipient of the participant must be 60 or older, and the caregiver has to be at least 18 years of age. They cannot be eligible if they're receiving in-home support from another publicly funded program. They have, for the strategic plan that they utilize, they have community partnerships and engagement. They have quality programs and services. I talked a little bit about those. And the Durham Center for Senior Life has 2 locations within Durham County, and they support older adults in 5 cities and towns, which include Durham, Rougemont, Gorman, Research Triangle Park, and Bahama. I'm running a little bit out of time, so I'm going to go on over here to talk a little bit about, the Volunteers of America national services, also called VONS. They're also called PACE, the Program for All-Inclusive Care for the Elderly. PACE has been in Durham County since 2013. It's been a great, I believe, success. The services are provided at the center. The services can be provided at the individual's home or in other locations that match the needs of the participants. This VONS has a PACE has an adult day health center, which is the center that I monitor as I do in the Durham Center for Senior Life. And while I'm on that, I just want to say that as the adult day health specialist, I'm responsible for quarterly monitoring into both of these facilities. And what I do is I monitor the emergency plans to make sure that if there's an emergency in this facility, that they have an organized plan to get everyone out safely, that they have some way that they can, it's portable to take with them to connect with families, to let them know how their loved ones are, and that they do regular drills. I also monitor for activities. Their plan requires regular activities, and the recreational staff activities usually takes care of that. They can sing, they can do dancing from the waist up, mind you. They sit down because we don't want anybody getting excited and dancing and falling. So everybody sits when they dance, but it's good exercise and it's good fun. I also monitor for the care plan. It's very important to make sure that even though they're in adult day care, they're also in adult day health, which means that we have to make sure that their health is being taken care of as ordered by the physician specifically for these sites. And we do that. We monitor for the healthcare coordinator's role. If it's a LPN, there must be a supervisor, RN supervisor that supervises her practice. And so what we do is we go through when the healthcare coordinator's role is being monitored. I sit down with the healthcare coordinator and the supervising RN if she's on staff. And if I need to ask her a question, she's always available by phone to make sure that she's meeting this individual, he or she is meeting all the requirements as stated in the Adult Day Health Standards Manual. That is my guidebook for these monitoring visits. I also monitor the participant records and medications to make sure that the medications are being given, excuse me, as ordered, that the label is ordered, that they're locked at all times, that the treatment room has all the equipment that they need to care for an individual. Excuse me. If someone needs to rest, I'm sorry. Excuse me. If someone needs to rest, there's a treatment room that's required in the adult day health center section of the facility. It has to have a door that's able to be closed. It has to, excuse me, must have a bed with a mattress. It must be closed to the public. No one can be able to look in and see what's going on. There's certain equipment they must have, and they must have a scale so they can weigh people if necessary. And like I said, the medications have to be locked and they have to be labeled appropriately. And now continuing on with the PACES program, what I just spoke of is refers to both of the adult day health programs. The adult day care programs don't receive nursing services because they don't have, excuse me, health services. Now PACE offers a multitude of resources for these participants who attend PACE. It moved from Stirrup Road. It's now on Miami Boulevard, South Miami Boulevard. They have PACE as door-to-door transportation to the center and to specialty medical appointments. The drivers provide safety oversight for participants during the loading and unloading because, most people have to get the lift, need the lift to get on the bus safely and get down safely. So they make sure that they oversee that and everyone is safe. They have medical and specialty care located within the PACE Center. They have a primary care clinic with exam rooms. They have a triage area there. primary care services are provided by their in-house primary care providers. So while there's a space, excuse me, in PACE, on one side, it's the adult day care space where everybody mingles together. But if the individual is enrolled in the adult day health program, there's a whole section to the building that has the primary care clinic for those individuals, that they can go over there anytime if they're experiencing any kind of symptoms or they don't feel well. They are able to go over there because they have these releases signed, of course, before they even attend. So nursing care is provided in the PACE clinic. They have on-call services are available 365 days a year. The specialty services include dental, vision, audiology, and podiatry as approved by their PCP. They can get lab work done here, x-rays, surgery, emergency care, hospital care. They're transported to a hospital if necessary. And prescription and over-the-counter medications are provided at no copay. They have an interdisciplinary team made up of the primary care provider, the registered nurse, social worker, physical therapist, occupational therapist, recreational therapist, registered dietitian, home care coordinator, transportation representative, daycare center staff member, and center director. The coordinated care is in place by the PACE interdisciplinary team. They provide a review of each participant's care plan every 6 months or more often if needed to ensure that all their needs are addressed. The interdisciplinary team collectively acts as a case manager to each participant and approves all services. Excuse me, they also have support with meals. They are served warm, healthy meals are served on weekdays at the PACE Center. And if necessary, take-home meals are also available. Therapy options are vary. PACE has a therapy gym with parallel bars, exercise bikes, physical therapy services, occupational services, home visits, and modifications to ensure a safe living environment. So these individuals make sure they go to the home to make sure that the same exercises they are able to do safely in the facility are also be able to done safely at home. They help with durable medical equipment such as canes, walkers, and wheelchairs as well. They have health and personal care services, vision care, dental care, hearing care, podiatry, and mental health and social services, which is so important because we don't want to get so focused on someone's physical status without addressing how they feel, because it's all connected. It's all connected. Someone could be mourning the loss of their independence. Maybe they can't walk as well. We need to pay attention to that as well. So these services are definitely interconnected, and mental health and social services are definitely involved in all of this. Okay, I think I'm about finished. That Medicare, to be eligible, dually eligible for Medicare and Medicaid at PACE, they must be eligible for this care. They must live in a designated area, be 55 years or older, be able to live safely in the community, and meet the medical and financial criteria, which is a bit different for some of the people. Well, for everyone, it's not the same for everyone, but a lot of people, if not most, are receiving Medicaid to help fund these services. I think my 10 minutes is up. Are there any questions? And my apologies again for my technical difficulties.
No worries at all, Ms. Scott. Thank you very much for the very educational presentation. My question is, and I hope I'm going to phrase it correctly, how well are these services utilized? Is there a waiting list? Is there still capacity for if more individuals were to sign up? Sort of how utilized are these services today?
From what I can see, the services are well utilized at the Durham Center for Senior Life. On my last monitoring visit, they have a capacity for up to 90 individuals, and that includes full-time and part-time. And that particular day, there were about 50 there, but also this was around the Christmas season, New Year. So, we would expect that people spend more time with their families around that time. PACE, I believe that they have a capacity now. I haven't seen them since December 30th, but the rooms, the they have a room where they work with plants, and they put their plants in the windows. The rooms are always full. The certified nursing assistants are always engaged with them, encouraging. But I would say now that the last visit I was at, when I spoke with the center directors, they didn't speak of a waiting list for either program at the time. So I don't know how much that's changed since after Christmas and we're going into February. But at the time I was last there, December 30th, there was no waiting list at either one. And the programs are well utilized. And when you go into the overall program for Durham for Senior Center for Senior Life, you'll see other individuals out in other parts of the facility, of the building. The ones in the adult day care and the adult day health portion are the ones that need assistance. And I think the other program certainly has plenty of room for as many people as they can hold, really, because the other individuals are independent. But for the adult day care and day health programs, I believe they do have some openings now. But it's very well used. They always have almost a full house, if not full, on the days I'm there.
Fantastic. Thank you very much. Really appreciate the presentation.
Thank you.
Any other questions?
I have one.
Yes.
Hi, thank you for your presentation. And this is so important in our community. I was just wondering, how are we getting the word out about these services available? I know I have a friend that really needs to call right now on behalf of her mother-in-law. So I was wondering about the number, but then also sometimes adult children end up in caregiving unexpectedly. And so that's just my question.
Well, from what I understand, that they have a resource list that's available at the center, but I don't know how that resource list, to be honest with you, is distributed. But what I do have is I have contact information that I would be more than happy to send forward to give to all of you all. And then I can also, when at my next visit, can pose that question to each of the center directors and see if the two of us at each center can work out some way where we can think of a different way together to get the word out about these resources. Because I agree, it's very, very important. In the interim, though, before my next visits, I'll get you all copies of the business cards, and I'll send it to Director Jenkins or Donna or Liz, and ask them to distribute the information to you all. And then after I meet with the separate program directors, I'll forward an update.
Wonderful. Any more questions? All right, Ms. Scott, thank you very much. Really appreciate your time for the presentation.
Thank you all, and I get that information to you all as soon as possible.
All right, fantastic. All right, next on the agenda, Ms. Page is going to present to us about programs for older adults.
Thank you so very much. And I am going to work on sharing my slides. And my IT person is Willa Robinson Allen, my program manager. Do you all see my slides?
We can, yes.
Okay, good. Now let's see if I can get them to move forward.
You may need to hit the slideshow at the top and hit from the beginning. Over on the top left there where it says from beginning.
I am here. Give me a second. We were patient with Cheryl, and please be patient with Joyce.
No worries at all.
Okay.
We can actually see the slides. If they can't go full screen, you can just click down through them. That's not a problem.
Okay. All right. Thank you.
Mhm.
See that slide? Do you see
Yeah.
it? Okay. All right. That will work. Again, my name is Joyce Page, and I'm with the Health Education Division, the Health Promotion and Wellness Unit. And the programs I want to talk to you today about are evidence-based programs that we offer focused on persons over the age of 55. And those programs are Living Healthy with Chronic Diseases, Living Healthy with Diabetes, Living Healthy with Chronic Pain, and our Matter of Balance Falls Prevention Program. Our Living Healthy program workshops have been in existence for over 30 years. They were originally developed by Stanford University, well-researched. They are conducted throughout the US and in several different countries. They're designed for people who live with long-term conditions like heart disease, lung disease, stroke, arthritis, diabetes, etc. The programs are facilitated by 2 trained leaders, and at least one of those persons has to have a chronic disease. They're facilitated by both staff and volunteers. Willa Robinson Allen and I conduct trainings each year, 3 times a year, to train community members as well as healthcare professionals. And healthcare professionals doesn't mean that you have to work in a healthcare setting, but they're persons who are usually in a professional environment, and most of them are working at the senior center, at parks and recreation. They're usually working in some field that's health related. Anyway, the trainings are given. They last 4 days, and for the first core training, which is a chronic disease self-management training, and then you can come in and take a cross training on pain management and diabetes management, and those courses are about 2 days long. The classes of workshops that are given, and this picture that you see a picture of some persons there, I hope, sitting at a table. Do you see that?
Yeah, we sure do.
Okay, thank you so much. That was a class held at W.D. Hill Recreation Center. And it consists of persons from the community who came in for 6 weeks, and they sit down and they participate in a highly interactive workshop on managing a chronic condition. Even though the people have different chronic conditions, they're all meeting together, which makes it particularly effective. The findings on the chronic disease self-management program, this was done by the CDC a few years ago, they found that persons who participated in at least 4 of the 6 workshops provided improved their health status and fatigue, shortness of breath, depression, pain, stress, sleep problems. And there was also improvement in the quality of life that they reported, their ability to communicate with their doctors, compliance with medications, health literacy and understanding of health information. They had fewer hospital visits, and there were significant cost savings. This is a photo taken from a workshop Will and I were conducting, a training that we were conducting with community volunteers. In this picture, all of the volunteers are members of our Men's Health Council. We have been very, very fortunate to have men join us in providing leadership and becoming coaches and facilitators of workshops. And they did this at a request to get more men involved. One of the problems we have in most of the classes we offer is that there are not very many men who participate. Usually it's 80% women. It's changed now since we got the Men's Health Council members to become workshop leaders and facilitators, and they also have become recruiters. The Matter of Balance program is another program that's evidence-based that we teach. And the purpose of that program is to reduce the fear of falling. My colleagues, and I see some of them are on the call today, they're probably surprised to see me. I had a fall a few days ago, walking my dog at night on a trail that was not lit. And as a result, I have a couple of black eyes, I have a fractured arm, and a few bruises. But I hope you can't see that because I got on my glasses and makeup is amazing. So I teach falls prevention, and I gotta admit I'm embarrassed that this is a fall that could have easily been prevented. My dog, 11 pounds, I was trying to keep up with him, and that didn't work. But anyway, it's a lesson learned, and I can tell other people what to do to avoid falls. And that's important to have the experience. So our Matter of Balance classes are really effective in helping people understand how they can prevent falls, how to keep their home safe. And if you do fall, to overcome that fear of falling again, because otherwise you're going to have more falls because you're going to become less mobile. We teach people strength exercises, coordination, balance. They meet 8 times for 2 hours. Our Matter of Balance classes are taught in the community. We have taught them also at the health department, but it's much better to meet people where they are in the community. This photo is of Gretchen, one of our coaches. Gretchen is a resident at Price Steel Apartments, Durham Housing Authority. And she's there on the exercise equipment. That's me in the middle. And on the side with the red shirt on is Dr. Annette Coleman. Dr. Coleman is retired Duke internist, and he comes in when we do the classes, the workshops, the trainings, and he offers a program on the aging process. He explains why we're changing as we get older, what we should do, what we can expect not to be able to do, and what we can do. He's well received, and the residents, whenever he comes, and anybody else who's in the class, those persons who are being taught to be leaders, they spend their time asking him a number of questions, and they feel very comfortable because he's a wonderful person to receive information from. He's a gentle soul. And he does this as a volunteer, if I didn't mention that. All of our community members are volunteers. They don't get paid, unfortunately. The trainings can be done in person and they can be done virtually. This is a class that we did virtually with the group from Chatham County. This is a workshop on falls prevention that was held at the Emerson Woods residential site for seniors. I love this particular session because we had several men. If you can tell, there are several men there. And at the end of this session, our workshop leader, who always came with a tie on and suit, this was a few years ago when we dressed a little bit better. I shouldn't say better. They were less casual, but our workshop leader, James, always made sure that he looked spiffy and brought gifts for the residents. At the end of the session, one of the men came up. He was age 65, and he asked James, "Will you please show me how to tie a knot?" He said, "I have never tied a knot." I'm not sure if I'm saying that correctly, but he said he never worn a tie and he didn't know how to. He said what he had worn a tie, but where he wore much younger person with those that were clip-ons. So James showed him how to tie that knot, and it was a fantastic experience. He was happy. I was happy to see it. The importance of having someone there that they could relate to, having another meal there was invaluable. And most of half of the people who attended were males, highly unusual, but that was because we had a male leader. This is a activity that we do in the community. It's not evidence-based. It is our walking program. Our Men's Health Council has a monthly walk at a different place, a different park or recreation center. This is when we were walking in November. And this is for everybody in the family. As you can see, they're all ages there. And the folks love to come together. Seniors love to be with all ages, and young people love to be with seniors. This is a picture of our Men's Health Council members, some of them. And we have men and women who are part of the council. The men said that they want women to be a part. We also have forums, and they're for men and women. Usually the forums are forums that come out of the conversations we've had with men, asking them, what topics do you want us to present? This flyer, this slide shows a workshop we held a couple of years ago on heart disease. One of our members had a sudden cardiac arrest, and he said he would share his experience with us, and he brought his cardiologist, and she talked to folks, answered all sorts of questions. It was a wonderful experience. And then we had a urologist from Duke come in and talk about common urology conditions for men. It was held at the church. Durham County gave a grant to the church, and the church used the grant monies to provide dinner for men, and we had over 62 men attend, and most of them were over the age of 50. The walks are extremely successful as far as increasing the number of people involved, and we get seniors involved. Back in fiscal year 22, we had less than 200 people who were participating now per year. Now we have over 400, so it's growing. Most of the people are over the age of 45, 62% and 45% are over the age of 55. And I mentioned earlier that, well, with our walkers, most of the walkers are male, 60%, and the other 40% are female. For those falls prevention classes and managing your chronic condition classes, we have mostly females still, 60 to 70%, and males of 30 to 40%. And this is a picture again from the walk where everybody comes together and exercises. So they not only just walk, they do warm-up exercises, and they also hear something, healthy living message. A lot of the males that live in the area are Vietnam veterans. So one of the things we do every year is we participate in a Veterans Day ceremony at the Vietnam Veterans Memorial. They not only attend, they actually are part of the program. They volunteer to read the names of deceased veterans that are from Durham. It's a moving experience and well worth it. These are some of the places that we partner with, sororities, fraternities, parks and recreation. Right now, we're partnering with the Black Men in White Coats, Duke medical students who have asked us if we would work with them and helping them develop some guidance on how to develop trust in the community between the hospital and the community residents. There's some more people, some more groups. We do a lot of things in churches, the residents, senior residents, and we were fortunate to get caught on camera by Dr. Julius Wilder at Duke. Has a grant with the Health Monitor Network. They publish magazines on health education that you see in doctor's offices. Anyway, it was called on YouTube, and they talk about the importance of community engagement. They focused on the Men's Health Council, but they also focused on other organizations, not just us. It was an honor to be acknowledged. The success of our programs depends largely on our volunteers and the fact that we include men. This is the last chronic disease self-management workshop we held. And you see we had 3 women present and 3 men. This was held at the library Southeast Library. And that concludes my presentation. Thank you all for listening to me.
Ms. Page, thank you very, very much for the presentation. You don't look at all like you had such a bad accident. So good luck in your recovery and appreciate you being here.
Thank you. In fact, my daughter just came in and turned on the light. I was doing fine without that light on. But thank you. Dr. Jenkins told me I could explain why I looked the way I did before I got started, but I thought the makeup had covered up enough of it.
You can't tell anything. You look great.
No.
Thank you.
The one question I had for you, you mentioned those the walks, the men's health walks that have started to increase attendance. I think you said they were quarterly.
They're monthly.
Monthly,
month,
okay.
We skip 1 month. We skip December, but every
Okay.
month we go to a different location, trail, or inside. The last 2 months for January and for this month, we're going to be meeting at Weaver Street Recreation Center because it's so cold. Otherwise, we meet at a park where there's a trail, one of the Durham City parks.
Okay.
It's every month.
How's that advertised? How do the community members learn about those walks?
I have a listserv. That's one way. It's on the website now for public health. Willa Robinson Allen also puts out which is on the website. She puts out a listing of webinars and activities, monthly activities. Various places, organizations will include us on their community announcements. We can do a better job with that.
No, I was just curious that obviously you're doing a good job with the level of participation, but was just curious how you got the word out. So thank you very much for sharing.
Thank you.
Dr. Jackson, I see your hands up.
Yes, Ms. Page, thank you so much for presenting on the wonderful work that you all are doing in the community. And I really enjoyed seeing the data that really supports the evidence behind the interventions. My question is there anything that you have on your wish list to something that you'd like to see expanded with this particular intervention that you would like to see, either emphasis on mental health or just expanding to more people? What would be on your wish list?
Thank you, Dr. Jackson, for asking. Everything you mentioned, I would love to reach more people. I love to. Joyce Page needs to be more duplicates of our staff members who are doing the service, because I have wonderful staff members who do this, who conduct these. Willa Allen, Yvonne Reza does the diabetes program, and Olivia Cunningham and Giovanna Rosario and Donna Rosser. There's several of us, but there are also several programs that we do. And because I am 75 years old, I think they think I qualify to teach those senior programs. And I appreciate that. But I also would love to have more volunteers doing it, but would like to see them get paid. I'd love to have more staff doing it too. The volunteers are wonderful, but they don't last forever. Volunteers are really good for coming in, and they might be with you for a few years, a couple of years, and then they have to move on to something else. Or because they're older, a lot of times they're not able to continue at the same level. We have a couple of volunteers now who've been working with us for 4, 5, 6 years, maybe even 7 years. But which is good. But I would love to have some type of way to maybe even have part-time, well, I am talking probably beyond what I should. Willa and Lindsay are on this call. They're they're above me, and they'll probably say, "Stop, Joyce, you need to write that grant." So I need to get more grant money in so we can have more people carrying out these services and promote it better.
Thank you.
Oh, and I forgot to mention that we have a program called Longevity, what we know from around the world, and I'm probably saying it incorrectly, but we have a forum coming up on March the 7th at 1 o'clock at South Regional Library. We've gotten a lot of good response from it. And we're going to have a speaker to talk about longevity and the blue zones and what we've learned from around the world on how to live long lives. And that our guest speaker is Dr. LaRon Jackson. I met Dr. Jackson at UNCM at the Minority Health Conference a couple of years ago. And I asked her, would she please do a presentation once I found out that she specialized in aging. And she promised me that she would. So she was going to do it in the end of January, but it snowed. So it's been rescheduled for March the 7th at 1 o'clock. And I hope everybody will come.
Looking forward to it. Thank you, Joyce.
Thank you.
Fantastic. Any other questions for Ms. Page? All right. Thank you very much. Really enjoyed the presentation.
Thank you all very much.
All right. Next on the agenda, Mr. Salter, we'll turn it over to you for an update on lead in the city parks.
Yes. Yes, sir. Let me see if I can get it presented for you. Okay, can everyone see that?
Not yet.
People say they can't see it. There we go. You can go with it. How about now?
Yep, looks good now.
Okay, apologies for that glitch. Okay, tonight I'm going to give number 3 update on what's going on with lead in the city parks. One of the things that I'll have to do each time that we do this, because it is going to be an ongoing issue that we're you know, it's not over. It's been going on for a couple of years now, and it's still going to take a while to complete. But in order to keep everyone up to date and up to speed on it, I've got to do a little bit of update on the history. So did that slide advance?
No, we still see the cover slide.
Not sure why this stuff is glitching tonight. Okay, how about now?
There we go.
Okay, so just a little bit of background on this. This whole issue developed because a graduate student from Duke's Nicholas School of the Environment theorized that some of the parks in Durham that were former incineration sites would have lead contamination in the soil. I think that he had done some research, and this is not a unique issue to Durham. Incinerators were put in place years ago when there was really no formal way to manage waste, and there was illegal dumping going on. Some of you may have grown up in rural areas like I did, and you could turn down a dirt road somewhere, and at the end, you know, there'd be trash and old washing machines and things like that. In order to alleviate that, incinerators were established, and community waste could go to an incinerator. They burned the waste, went up in smoke. The ash that was left over just was like a field, and they thought it was over. It was all done. Little did they know that they were introducing contamination in the form of lead and other contaminants. So 3 of the parts that are part of this issue were tested by this graduate student, and he did his results came back positive for lead at Walltown Park, East Park, and East End Park. Lyon Park was also an incinerator site that he did not test, but later on was tested for by the city in a good faith effort to determine if there was a problem there as well. Anyone who knows the layout of Durham and the parks, Walltown Park and Northgate Park, know that they're not very far apart. They're both located on Club Boulevard, and Northgate has contamination because tons of the ash were trucked down from Walltown to Northgate to use as fill. So they didn't know they were introducing contamination, but that's what happened with Northgate Park. So that's a little bit of background on that one. One thing that I would like to point out with the history of this is that this testing was done without authorization. The city didn't know it was occurring, and they didn't find out until after it had initially occurred. The student who did the testing initially did not follow EPA protocols. So once this issue came to light, the city had to contract with another company, environmental company, to come in and do subsequent testing to confirm that there was an issue. And after they did testing, they did confirm that there was lead contamination at these parks. Why is this important, and who is at greatest risk? Again, I'm gonna move pretty quickly through this because everyone on this panel knows this. Children under the age of 6 are at greatest risk because of the habits that they have. They chew on things, they put things in their mouth until they get older. Why is it a problem? Because lead causes brain damage, causes damage to the nervous system. It slows growth and development. It results in learning and behavioral problems, hearing and speech problems. And once that damage occurs, it can't be undone. So a child has to live with this for their entire life. So that's why. Significant activities occurred since the last time I reported on this, which was last April of 25. 4 soil workshops were coordinated by the city. There's more than soil testing that was done at these workshops. There were several groups from the community did educational. We provided educational information through handouts and discussions and tried to answer questions and concerns that people in the community had. NC State did soil testing. Now, prior to these events, and I've got the dates and the locations of the 4 events that have occurred. Prior to the events, trained volunteers went out and canvassed the communities around where the event was going to be held, close to or at the park. And they walked people through collecting soil samples. And they also discussed, issues around collecting samples and what would happen with the sample and all that. And if the property owner couldn't or didn't want to do it themselves, they offered to do it for them. So a lot of soil samples were collected prior to these events, and NC State ran those prior to the event. Sometimes there were upwards of 40 plus samples, maybe more. A lot of that information is not shared due to privacy issues, but a lot of sampling was done before. But during the event, people from the community could bring their own soil samples in, and they would be analyzed on site at the event. The last of these soil workshops was when I put this slide together, hadn't been determined yet, but now it has been determined. It's going to take place on Saturday, March 14th from 3 to 5 p.m. at the Partners Communities in Partnership facility on 101 South Driver Street. And I will be attending that one. I attended the first and last one of these 4. One very important aspect of this slide I'd like to point out is Durham County Department of Public Health provided blood level testing at all of these events. And there were 0 children tested. There was no participation at all, but we were there. Lakita Sanders was there. She is the person who handles this type of testing for us, and she was there and present and ready to go at all 4 of these events, but no one participated in it, so no children were tested. DEQ's pre-regulatory landfill program. So back again, this goes back to a little bit of history. When this first began a couple of years ago, the city didn't know how to react to it. They never had to deal with this kind of thing before. So they reached out to public health. We had a meeting. During that meeting, We discussed with them bringing state environmental epidemiology and occupational health in. They have industrial hygienists on hand, and they deal with things like this from time to time. And so they would be a real good resource. So we brought them in, and the next meeting we had, someone from that group said, hey, I know someone with DEQ, Department of Environmental Quality, who may have some funding that could help with this. So we pulled them in, and the next meeting, that person, the representative from DEQ, said, hey, I think we can help you. We've got some funding that might be available to you if we can bring you in under an existing program called the Pre-Regulatory Landfill Program. So that's how DEQ got involved, and they started the process. They pulled them in under the umbrella of pre-regulatory landfill. The big point to make here is, in the beginning, lead was the only issue that we were concerned with, lead in the soil, right? The pre-regulatory landfill program has set parameters and things that have to be done in order to qualify for the funding that's available for remediation. And that is not just lead in soil sampling. That's a wide array of stuff. And it's not just lead. It's a lot of different types of contamination. The list is exhaustive. It goes on, the things that they look for, but they also do surface water sampling, gas samples, and groundwater samples. So they had done most of the soil sampling that I demonstrated in previous presentations, but since that presentation, they had completed 4 rounds of 5 out of 5 of the sampling for gas, groundwater, and surface waters. They were supposed to finish up this in January and generate a final report by the end of February. I could put together a 2 or 3 hour presentation on slides that are filled with sampling diagrams like this. So I just had to pick an example, but this is one I just wanted to show how intense the sampling can be. They drilled wells and they went down 25 to 45 feet. My assumption, I don't know for sure, but my assumption is they just went down until they started getting enough groundwater where they could sample from. But you see all these little blue dots in here, they represent monitoring wells. And you can see these little balloons that go back to each well, like monitoring well number 1, they found chromium at 21.6 micrograms per liter. Well number 9, they collected cobalt at 2.75, manganese. There's cobalt, manganese over here. There's a lot of different types of contamination, and this slide just demonstrates some of that. City Parks and Recreation, what are they doing now? The city is continuing to communicate progress updates to the public and engaging in community leaders and organizations. There's a lot of interest in this, as you may well know. The most recent community meeting was held on January 27th. I was present for that. And there are more meetings planned. They're ongoing. As a matter of fact, there's one in another week or so that I'll be in attendance to. And it gives the community a chance to ask questions and voice concerns. They're also in the process of scheduling the final soil workshop, which I already touched on, as well as a town hall. Testing of playgrounds. I put these slides, these next couple of slides in here because obviously we said, you know, who is this of most concern to? Is children, right? Unfortunately, all of the playgrounds within the parks were located in areas where there was what's referred to as waste disposal areas. And I'll touch on that a little bit more about what that means. But if you look at this particular diagram, you see these black hatched areas. This is a playground area that's outlined with a black line, but these black hatched areas are where waste, incinerator waste, was found in the top 12 inches of soil. And I'll expand on that a little bit in the next couple of slides, but the red hatched areas are where areas that exceeded the EPA threshold for lead at 200 parts per million. If I back up to the original soil testing, when this first began, the EPA threshold was 400 parts per million. And in January of 24, the EPA cut that threshold level in half. And so it went from 400 to 200. So some areas that initially were tested were deemed safe. they had to go back and redo because they were below 400, but they were above 2. So now all of a sudden the EPA cuts the threshold and they become issues. So that's significant. So this is another diagram where Lion Park playgrounds are located. You don't see any red hatches, so lead's not of a concern here, but there is incinerator waste there. What does that look like? Well, you know, if you're from the Piedmont area, especially here in Durham, we're in an area referred to as the Triassic Basin, and our soils are orangey, yellowish looking. They have a high clay content, and they, you know, all the soils around here look like that. These photos on this slide show you what incinerator waste looks like. It looks like soil, but it's not. It looks like a very rich organic soil. So its point is, it's very easy to start boring holes and finding this and going, hey, this isn't naturally occurring. This is incinerator waste, because it's very different from the naturally occurring soils that we have here in Durham. And this is an example of some of what's referred to as incinerator waste. You got big chunks of clay pottery, ceramics, glass, brick, sometimes metal, where the incinerator process wasn't complete. So this, you can imagine, if you're finding this in the top 12 inches of soil, it's of concern, especially if it's in a playground. Unfortunately, all of the playgrounds were located in areas of incinerator waste, so they'll have to be relocated. Remediation costs and possible solutions. This is the one that is most often referred to as the most feasible option to address this problem, often referred to as a 12-inch cap. So when you do a 12-inch cap, you have to come in and you do, very first thing, you have to record land use restrictions for a property. And then DEQ will issue a notice of environmental contamination. Then, this is a very unpopular thing, all of the trees in the waste areas have to be removed. There are some exceptions to that, but that's very, very unusual for DEQ to grant those. And some, if the city stepped in and said, we want to keep a tree here, or we want to keep a tree there, they would have to go into an agreement that if something happened, the tree fell over and it disrupted the soil cap, and there's a membrane that has to go down before the soil cap goes in, the city would have to take full responsibility for that liability and repairing the problem. Stream banks, all except one of these parks have streams that run through them. So the stream banks have to be addressed. They have to be stabilized before the 12-inch cap goes in. Installation of 12 inches of clean soil and vegetation to cover all the waste disposal areas. I put a couple of links on here. If y'all wanted to explore this a little bit more on your own, those links will take you to some sites, the DEQ sites, that will give you a little bit more information. What is this going to cost? These are very rudimentary, very early on approximations of what it may cost if they did go with a 12-inch cap. You can see East Durham Park, 1.8 million, East End Park, $750,000, Lion Park, 1.2 million, Northgate Park, 2 million, and Walltown, 4.5 million, for a total of $10.5 million. And again, these are very, very rough numbers that will likely change, maybe significantly. One of the things we talked about in previous presentations was determining what the boundary of contamination is. And we talked about background sampling. So sampling within the areas that you know are contaminated in the park, if they go up to the boundary of the park, obviously you haven't determined the extent of the contamination, because you're seeing it up to the boundary of the park. So now you got to go on private property, right? In order to do that and do sampling outside the parks on private property, you have to go through a process to get, you got to get their approval, and there's legal documentation has to be signed. And there are hurdles that you got to overcome when you do this. there are reasons why people don't want to do this. And the first bullet, I don't have to expand on that, government distrust, impact the property value. So you own a property that abuts a park, you come in here and do sampling, you find contamination, what happened to the value of my property? Perceived liability, what if something happens and, you know, somebody says, oh, I was on your property and I got exposed to this contamination, is it your fault? Even if it's not, if it's a perceived liability, you know, someone's perception is their reality. So it's a hurdle that you got to get over in order to get permission to do sampling. Land use restrictions. You can't do certain things on these properties. You can't dig, you can't go in and plant new trees. You can't do a lot of stuff. So there are land use restrictions that are imposed if contamination is found on your property under this program. Required maintenance, there is annual maintenance that has to take place every year if you come in under this umbrella of pre-regulatory landfill. Perpetual reporting, you have to submit a report every year to DEQ about what's going on. Did you do these things? Attest to that you did these things that you're required to do. Loss of privacy. So everything that's done with your property in regard to pre-regulatory landfill program is public record. So you might know that DEQ is coming on my property to do testing. You come and ask me, well, what did they find out? And I say, I don't want to discuss it. I don't want you to know. You can make a public records request and find out anyway. So you've lost that privacy. Property owners that do voluntarily submit to the sampling are eligible under the umbrella of the program for remediation, financial assistance and remediation under this program. So that is a positive. That's something that's got to be pushed in order to get this done. Obviously, if they remediate, they go in and remediate, the risk to your health is reduced. So that's the big value of somebody submitting to having this done. That is a process that's going to take time. It's not going to happen overnight. They're struggling right now to get that done. I can't tell you how long it's going to take, but that will take. We're good 2 years plus into this now, and it's going to be a lot longer before it's finally completed. That pretty much wraps up what I had for you tonight, but I'll entertain any questions that anyone has.
Mr. Stelter, thank you again for your continued work in monitoring this, participating in the education and keeping us informed. We really appreciate it. One first question I just have for you is, of that $10 million initial estimate, where does that funding come from? And you may not know this answer, but that's just one of the top questions I thought.
I believe that the entire amount could be covered under the pre-regulatory landfill program. It's Superfund funding that the EPA grants to DEQ. And I believe it is a $12 million cap on, I shouldn't use the term cap because that's what it is, 12-inch cap. But I believe that's the amount that is available, or at least it was. In the beginning, that was the number that was thrown out there. With all the changes in government, what's going on, I'm not 100% sure, but I believe that's still in place.
Okay, fantastic. Thank you very much. Pam?
Good, thank you. Thanks for the presentation. You answered one of my questions when you were talking, because I was wondering what happened with the blood lead testing that you said you offered, and you told me you said that nobody came to it. So that answers that question. But Medicaid is required, pediatricians and doctors are supposed to be providing blood lead tests to children when I think they're 12 months and 24 months, if I looked it up correctly. Do you get information about the results of that so that you can do remediation? And is there any coordination between what you're doing in the community in those parks with the people living in the surrounding areas who might have gotten tested through Medicaid?
Through Medicaid, as far as the parks go, I hate to say this, but I think we got criticized for not advertising testing early on. And we had a clinic that was stood up for a week and a half, maybe 2 weeks. And we had very little participation in that. Even though it was advertised, our PIO had it out on all our social media platforms. There were press releases. It was shared with county PIOs, and they did the same. It was advertised. There was just very little. I think there were actually only 3 children tested during the stand-up that clinic. So we offered it again during these soil workshops and had no participation. But to answer your question a little bit better, in regard to children that are tested by pediatricians, when they are required to submit those results to the state, and what happens is if a child comes back as having an elevated blood lead level, which is 9.9 10 micrograms per deciliter or higher, then we get notified by the state public lab, and we offer an investigation to the parents of that child or caregiver of that child. They, by law, they can turn that down. They don't have to allow us to do an investigation, but that's part of what we do here in environmental health. If the child comes back as poisoned, then that's above 10. I'm sorry, I got it reversed. It's 5 to 9.9 is elevated. If it's 10 or higher, they're poisoned. That's what we refer to as a CLIP, a CLP, confirmed lead poisoning. We offer the investigation, and if we are turned down or we're told no, we don't want that, then we have to go to county legal, because it is statute. It's a regulation. It's a general statute, a law that says you have to do this testing. You have to allow us to come in and investigate and try to identify this hazard.
So then let me do a follow-up on that. So I understand that it comes back to you. Have you noticed that there isn't a heightened number of children around these parks
No.
with high blood levels?
No, ma'am. With the very, very beginning of all this, I went to my lead program specialist and I said, right now, stop everything you're doing. Run pull up all the data on all the elevated levels, all the CLPs that we have, do a 3-mile radius around every one of these parks and see if there's any clusters, anything at all that looks suspicious, and there are none.
Okay, good. That's what I was trying to get.
Every one of the cases that are close to the parks, the hazard has already been identified either in the home of the child or some other place that the child frequents.
Okay, thank you. That was
that in the very beginning.
That's great.
Dr. Rhodes, you had a question.
Yes, thank you so much, Mr. Salter, for your presentation. And I was just wondering, I imagine that runoff can be an issue in these contaminated areas. And I was just wondering if there's any community gardens that are adjacent to these areas, and if there's any warnings or required testing for those.
I'm not aware of any community gardens that are close to the parks. But one of the things that we did do during the soil workshops, where we shared information about gardening, and in areas near, in known contamination areas like this, raised beds are recommended. There are some vegetables that it's not an issue, some that it can be, but if you use a raised bed, it's typically not going to be a problem.
Okay, thank you.
Mr. Brown, you have a question.
Yeah, sorry if you already covered this, Mr. Salter, but for the 12-inch remediation cap, if that is a solution, is that a permanent solution, or will this have to be reapplied every 3 to 5 years due to like soil erosion, for example?
It could be. Yeah, it could be. It's considered a good option, a good from a financial state, and it is effective. You gotta keep in mind, anytime that you start talking about this problem, and I think people tend to overlook this, there are two primary ways that a child becomes lead poisoned. That's through ingestion and inhalation, right? So I always say, don't let your child eat dirt. And if the park is covered with grass, there is very little, if any, dust that flies around. And lead poisoning and elevated blood lead levels are not a one-time event. This usually occurs, almost always occurs with repeated exposure. So, you know, if your child goes out and they pick up soil, they don't get lead poison by touching soil that's got lead in it. They get it from eating it. So I always say, you know, you got to look at the hazard and the risk. You know, I always say you put your child in a car seat, drive out here on the highway, there's a risk there, right? There's a hazard and a risk, but how high is that risk? If you don't let your children eat dirt, soil, and I use the term dirt, you know, that it's a low, I think in my opinion, I'll just say that it's a lower level risk than a lot of people perceive. But yeah, anytime there's damage, like I said, there is a fabric membrane that has to be put down before the fresh soil, the 12-inch cap. And if someone goes in and accidentally digs, you know, it's got to be repaired. That's why the membrane is there. It's orange and it actually says on it, do not dig and that kind of thing. So it flags people, hey, you shouldn't be doing this. But erosion, obviously we talked about there are streams that run through these parks, and there can be and probably will be over time some erosion. So there will be repairs that have to be made.
Thank you.
Thank you. Dr. Verbies?
I was just curious. So we'll get to build new playgrounds, right? Because we are going to replace the playgrounds on the property, right? And if so, is there an opportunity to work with the community to build those as inclusive playgrounds?
That would probably be a question better answered by City Parks and Recreation. I do know, I can speak to this. I know that their director is working with schools that are close by and trying to get an agreement to allow people to use the school playgrounds until we can get this problem corrected. So that's one solution that's being posed out there. And I think it's a feasible option in some areas because like Northgate's a good example. Club Boulevard Elementary School is right next door. So if people were allowed to go over on the weekends and when school was closed and use that playground, you know, that's a viable solution.
All right. Well, as always, Mr. Salter, thank you very much. A very informative presentation, and appreciate you really keeping us up to date with everything that's going on.
Well,
all right. Thank you, everyone. It's a long meeting today, but we got some great content. So we'll go on to the next portion of the agenda. Dr. Jenkins, first is the public health vacancy report.
Thank you, Dr. Ray, and good evening to this illustrious board. If you all don't mind, I'll go back up to number 5. We didn't recognize any staff or programs, but no worries. I think you kind of stole my thunder. I just wanted to really extend a warm welcome to Dr. Rhodes on behalf of our agency, just to let her know we appreciate her stepping up. It was a seamless transition from Dr. Glover to Dr. Rhodes because Dr. Glover recommended Dr. Rhodes. So we look forward to a proper introduction to possibly a tour for both you and Dr. Verbies, because I know that's something that she asked for as well. With that, we'll go into the vacancy report, and we continue to, not much to report. We continue to be right at about 9.7% and precipitously dropping. Very proud of the staff for continuing to stay the course, and it's making sure that our recruiting and our retention efforts are there. We still maintain a vacancy of about 25 positions over the last 2 months, and we do expect for that to change rather soon. Back to you, Mr. Chair.
Thank you. I was impressed that there were no positions that came vacant in December. That probably was a unique month, but it looks like we ticked up just a little bit in January then.
Yeah, history has shown that over the holidays, people contemplate where they are in their lives, and they normally come back in January with resignations.
Makes sense. All right. Any questions about the vacancy report? All right. How about the NOV report for this month?
I don't have anything significant to report. If there are any questions, I can certainly take those. But the only thing I would point out is last time I reported on the Cheat Road property, it looked like we might have to end up going to court to get that corrected. The property owner has gotten approval to connect to municipal sewer, and he has communicated that he has a funding source and he should be able to get the connection fee paid for very soon. Hopefully that occurs and we won't end up going to court, because that's not what we want to do, for sure.
Fantastic. Well, keep our fingers crossed that continues to move in the appropriate direction. All right. And then the health director's report.
I'll be real brief. Definitely will answer questions as this board raises them, but we continue to be very impressed by our staff and the great work that they do. Dine continues to do a great job, not just in Durham, but also across the country. So there's some information about some of the things that they participated in nationwide. Big shout out to Jason Smith, who's our opioid settlement manager. He has successfully seated the opioid steering committee, I think better known as OSAC. And that was no easy task. Had a lot of work was involved with that. Our population health division provided an update on our community health needs assessment, which is very important. Over 1,200 surveys were collected. That's the most that we've ever done. We certainly are going to have a very robust, hopefully another award-winning community health needs survey, but really lifting up Marissa Motorboy and Bria Miller for the great work they do, as well as members of that community as well. And the last thing we had was our mobile medical unit. Just an update on that. We were really looking forward to showing it off today, but hopefully we will be able to show it off in April when you all are able to come in person and to really work on that. But again, we're thankful for Jim Harris for submitting that information about the mobile medical unit in tow with Corey Morris, our preparedness coordinator. A lot of different people, a lot of hands are on deck to make sure that that's a success. And we look forward to getting that on the road and being able to provide public health throughout Durham County. Mr. Chair.
Dr. Jenkins, thank you very much. Does anyone have any? Dr. Silberman, please go ahead.
Okay, hey, thanks, Dr. Jenkins. Can you, I noticed in your report that you talked about the QI and that you're doing a lot of training for different divisions around quality improvement, but you didn't say anything about what your quality improvement initiatives are. Like, what are you targeting? What are you trying to accomplish? I would love to hear a little bit more about what you're trying to do and what the success or non-success has been with those QI initiatives.
I would do you one better. I would love to be able to provide some form of an update for you at the next Board of Health meeting. We do a lot of QI, some of it as required by accreditation, both national accreditation and local accreditation. But then we also do some QI throughout the clinics and throughout environmental health. So, again, that is under the purview of population health. And Rochelle Talley does a really good job of it. There are some ebbs and flows, as you would imagine. Sometimes it's hot. We really got a strong initiative. Other times, not so much. But the most recent thing we did was, of course, we had a lot of cleaning up to do, a lot of organization to do. So we really use that as a QI project to really sort of, I guess, knock the dust off of the memory banks of our staff who's not necessarily participated in a collective QI process as of lately. So please know that we were more than happy to present that to you all at the next meeting, if that's acceptable with Mr. Chair.
Yeah,
sounds great to me.
You don't need to talk about all of them, but it would be great if you could highlight some of the most, the things that you think are critical for the success of the public health, local.
More than happy to. Absolutely.
Great. Any other questions? Yeah, Dr. Rubies, go ahead.
I was just curious, and maybe I missed this on the agenda. Are we going to have a chance to talk about measles?
We were going to really talk about that maybe toward informal discussion if that's
Okay. I can wait. Thank you.
Sounds good. All right, if there are no further questions, we will go ahead and move on with the agenda. Looks like we have nothing to report from a committee reports perspective, nothing on old business. We'll move on to new business. Looks like we have 2 budget amendments.
Yes, sir. Go ahead and get started with the first one. The board is requested to approve $576,219 in general fund appropriation to increase Durham County's contract with WellPath. That is our jail healthcare provider to provide comprehensive medical services for inmates in the Durham County Detention Center and residents of the Durham County Youth Home. We broke it down. The $576,219 would be for off-site medical fees for $75,000, average daily population $10,000, medications $300,000, MAT phase 2 $191,219. In November of last year, there was a law that was passed as a result of some of the actions that happened in Charlotte. And this has caused the average daily population at the jail to really increase. And as a direct result, there are some costs that have been incurred. So this is an effort to really ask the Board of County Commissioners to really meet us where we need to be in order to provide the provision of that care. The last one, the board is requested to approve an additional $30,000 from the North Carolina opioid settlement to purchase naloxone. We have been doing extremely well with our naloxone distribution in Durham. This is a medication used to reverse opioid overdose. It is an Exhibit A strategy under our memorandum of agreement, and community distribution of naloxone has been a significant part of our opioid response. As you all well know, we have a number of different initiatives to include naloxone vending machines, both at the detention center and at the health department. We just purchased, I want to say 1, maybe 2 more vending machines. So we look forward to providing an announcement of that. So again, we want to make sure that we keep them all stocked. So again, funds will be allocated to Durham County Department of Public Health, and the $30,000 of additional funding will bring the total funds allocated to harm reduction strategy to $371,143 for fiscal year 25-26. That is all, Mr. Chair.
Thank you very much, Dr. Jenkins. Mr. Gregorio.
Thank you, Director Jenkins. Just a quick question for the naloxone. Did you mention, or did we choose a location for those 2 additional sites yet?
Still to be determined, but we're trying our best to really get it in North Durham, and we are still in deliberations with the library, but we certainly want to have it in areas of high traffic, but most importantly, of areas of high need.
Absolutely, thank you. And just another follow-up for the second one regarding the schedule. There, I just saw line 2 through line 5. Is it because of the WellPath is line 1 essentially?
That's correct.
Okay, cool. Thank you.
Great. Any other questions? All right, hearing none, I'll entertain a motion to approve the 2 amendments.
Motion to approve.
Second.
It's been motioned and seconded. We are ready for the vote.
Dr. Ray,
Yes.
Dr. Jackson,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
Dr. McDougall,
Yes.
Dr. Miller,
Yes.
Dr.
Yes.
Ortho,
Yes.
Dr. Rhodes,
Yes.
Dr. Silverman,
Yes.
Commissioner Valentine, and Dr. Verbiest.
Yes.
Thank you.
All right, fantastic. Thank you all very much. All right, shifting gears just a little bit, let's talk a little bit about our next meeting in April. I know that we wanted to meet in person. It wasn't going to work out this month because we weren't going to be able to get to a quorum because of availability. Next month, it's currently scheduled for April 9th. I would personally like to ask if we could potentially move the date to the following week, because simply I'm on spring break that week and would love to be there in person, but would plan to be out of town. So I don't know what the formal process is to change meeting dates, or if I have to make a motion or whatnot, or have some discussion around that. I'd love to have it in person, love to do that soon in April, and would want to entertain if anyone would have a problem switching from April 9th to April 16th. Yeah, Pam?
I don't have a problem, but I don't know if there are other people who are going to Full Frame Documentary Film Festival. It starts that night, so just people should be aware of it if that would be a problem for others.
Well, it doesn't sound, Anthony, you want to mute?
I'm good with that date.
Okay. Dr. Jenkins, do you think that would, do you need to query anyone else at the department to see if changing the dates would be an issue?
We will be more than happy to do it. I do personally have a conflict on the 16th. I will find a way to make it work. I serve as the board chair for Durham's Partnership for Children, and I believe that is our 30th anniversary big gala, whatever have you, but we will work it out. We will find a way to work it out.
Well, I appreciate everyone's flexibility, and Dr. Jenkins, if that doesn't work, please just reach out to me and we can get back together.
Could we
Yes.
poll and see about April 2nd as an alternative?
Doing it earlier,
Yeah, just a week earlier.
that would be fine.
Yeah.
For me also.
That works better for me because I was going to go to the film festival, but I would have put it off if I needed
sure.
to. Does that work for you, Dr. Jenkins?
I will not be here, but if you have a quorum, don't worry about it. I'll be in San Francisco on the 2nd.
That works for me. We can make it work.
That works for me. We were going to have the tour at 4. Is there any way it could be more like 4:20 so I could get there? I have something that goes till 4.
We can make that happen too.
Okay.
Yeah, why don't we say start at 4:30?
Yes, sir.
Dr. Jackson says that works. Okay.
Just Dr. Jenkins, if you would just put me down as absent, that would be great.
Yes, ma'am. We will miss you, but we
That's
will do
all
as
right.
you ask.
It's okay.
All right. Well, thank you, everyone, for entertaining the switch for my personal schedule. I appreciate it. What about agenda items for the next meeting?
We will provide the QI update
Yep.
as requested by Dr. Silverman.
Okay. Sounds like we're going to tour the mobile unit, and perhaps Dr. Jenkins, maybe some type of formal presentation on how that plans to be used. I know in the director's report there was some activities planned starting in the spring and summer, so that might be good to pair together.
Happy to do it.
And given what Sarah said, I know that we might talk about an epidemiology sort of communicable disease update now, but I think we should put, as long as measles is sort of on the rise, I think we should just have that update always to know whether it's affecting us in Durham.
We can make that happen as well, Dr. Silverman. It's a great suggestion.
All right, fantastic. Well, this seems like a good point to transition to that discussion. I know, at least I've seen reports of exposure in Durham. I believe last week, Wake County's had exposures. So, Dr. Jenkins or anyone else, I think we'd love to just hear if there's anything that you can update us on besides what's we've seen in some of the lay press recently.
Yeah, especially since we hear about South Carolina every day.
Yeah, absolutely. I will say we have been preparing for measles for quite a while. To include, several months ago, we had a tabletop exercise where all players were at the table. And a lot of it has been relayed to you all, and we appreciate your support. To the listening audience, I will say vaccination is the key. We certainly will hope that, your children are vaccinated. We hope that you're vaccinated. We hope that you would take precautions to make sure your vaccinations are up to speed. We on the 6th of February, we were notified that there was potential exposure in Durham in 3 sites. Our website and all social media communications have been pushed out to really announce this. We took a very cautious and proactive approach to contacting those businesses to ensure that they were aware of it and to also ensure that their staff were properly vaccinated as well. I'm proud to report that just about all of them were. And I think there were a few stragglers that we're still waiting to hear from. But per protocol for the state, we had to really reveal that those places were frequented, and they put them on there. Of course, we know measles is highly contagious, the most contagious diseases out there, and we also know that somebody could be here and then 2 hours later it's still there on the surfaces.
Right.
So what we have been doing is really, as far as it relates to this, we've been doing our best to really educate the community, to alert the community, those individuals who've been to those 3 places, to really go and just monitor themselves, or even better, go check with their primary care physician. So with that, we have in our preparations, our targets, our number one priority is children, and is certainly with the school system. So I'm proud to say that I've been interfacing with Dr. Anthony Lewis, who is the superintendent, and his staff. Just give all credit to Director of Nursing Kiki Rayner and School Health Program Manager Sarah Snyder and many others who have been really checking to make sure that our vaccination rates are where they need to be. Of course, we know 95% is the standard that garners herd immunity, but we do have a ways to go in as much as really getting Durham up to speed. I will say to the listening audience, the dashboard says one thing on the state. However, we have been working with the state because we did not feel like those numbers were representative of Durham County proper. And I'm proud to say that the state, again, has been in communication with us. So we hope to see some type of change or whatever. But again, we're doing our best to make sure that we get to that percentage point that we need to get to. But with that, I will start with vaccination is the key. I will end with vaccination is the key as I entertain questions from this illustrious board. But I just will say that, we are prepared, we are ready. We have robust partnerships, and we are getting the word out that this is a clear and present danger. Public health in the state of North Carolina, all of us collectively, and working with the Department of Health and Human Services, are taking this very seriously, as should our listening audience, as should our communities, because we don't want a slow burn to really ignite a wildfire. And right now, that's what I feel it is. It's a slow burn. My heart continues to go out to my good partners in Buncombe County and Polk County, Mecklenburg County, Gaston, and places in between. We certainly want to do everything we can to keep our community safe. So, Mr. Chair, any questions I can ask? I also have our medical director, Dr. Jenks, on the line. Anything he wants to add as well, he's welcome to come forth. Jeff?
All right, I'm coming off mute here. There we go. Yeah, I think you summed it up, Dr. Jenkins. Especially with vaccination is key, and we've got MMR vaccine, which is very effective and very safe. It's one of the best vaccines we have. It's been around for decades and decades, good safety profile. So that's really the key, vaccination. And I think you said it really well, Dr. Jenkins. I'm happy to answer any questions as well.
Thank you, Dr. Jenks. Mr. Chair?
Yeah, just one question, and I should know this answer, but please just reaffirm what my thoughts are. If someone is fully vaccinated and they were exposed, there's not necessarily any action, or if they feel like they were potentially exposed, let's just say that, there's not necessarily any action that they should take other than monitoring for any symptoms related to measles. and if they do exhibit some of those initial symptoms, seek out the guidance of their healthcare provider.
Yeah, Dr. Jenkins, I can take that. Yeah, you're completely right. If you're fully vaccinated, you're around 97% protective and getting measles. So if you are exposed, yeah, there's a chance of getting a breakthrough infection. But the current recommendations aren't to quarantine. So yeah, you just go about your daily life, but monitor for measles symptoms for 21 days. That's kind of the upper end of the incubation period. You're right. Yeah.
Okay. Great. Well, thank you all for your efforts. This unfortunately probably will not end soon. And let's just hope for all the best for our community, and appreciate you continuing to advocate for the vaccination piece, because that's really the key to success. All right. Any other questions or informal discussion? All right. Well, thank you all for sticking with us tonight. We've had some great content tonight. It's been a little bit longer than normal, but appreciate everyone sticking with us and putting up with me as I messed some things up on the agenda today, but we're almost through. So I will entertain a motion to adjourn.
So moved.
Second.
All right. We've had a motion that's been seconded. Liz, if you're still available.
Indeed, I am. Dr. Ray,
Yes.
Dr. Jackson,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
Dr. McDougall,
Yes.
Dr. Miller, Dr. Orto,
Yes.
Dr. Rhodes,
Yes.
Dr. Silberman,
Yes.
Commissioner Valentine, and Dr. Verbeest.
Yes.
Thank you.
All right, everyone. Thank you very much. Appreciate your time and attendance today. And Dr. Jenkins, perhaps we can get together. I think there's a calendar invite for that April meeting. We probably just need to update so that everyone's on the same page.
We look forward to it. We'll have everyone squared away.
Okay, it's fantastic. Thanks, everyone. See you again in about 7 weeks.
Thank you, everyone.
Thank you.